Hi everybody, I'm Marla with 9 Health and welcome. Thank you for joining us today. It is Mental Health Awareness Month, and so we are bringing you an educational series. Every Friday of this month we're going to be talking about a different aspect of mental health. And so today here we are with our friends, and we're going to introduce them in a minute. We're at Mental Health Center of Denver. You guys can correct me because this is Facebook Live, so if I say it wrong, you just tell me, okay?
Right.
But we're here and we're going to be talking a little bit about teens and young people. So their mental health and what are some of the issues that they face. If you have some of those people like that at home, you may know even more than we do. And so please ask us your questions if you have them. We're here to try and answer your questions and really shed some light on this subject of mental health. At 9 Health, we are known for helping people with preventive care in their physical health, but just as important and equally tied to your physical health is your mental health, and so we want to delve into that this month. So that is what we're doing, and you guys are the experts, so licensed professional counselors, I got it right. This is Darren Kessler, and we're also joined by Kimberly Bowe. So thank you guys for being here with us. We really appreciate it. I want to kind of dive in and start with maybe a little bit about both of your organizations. So Darren, if you could start and just tell us a little bit about what you do here and what the goals are.
Very good. Well, as the Mental Health Center of Denver, we have about 800 employees and serve 10,000 or more people.
Mm-hmm.
But I work in the Child and Family Department, and that's where we're at right now. And so we actually, as Child and Family, serve from 0 up to 17.
Okay.
And my particular role is to do a lot of assessment. I'm the first contact for when people call in wanting to get help. I help assess, help understand what they're needing, where's the best place for them to get it, and get them set up.
That's really great. So I want to delve into a little bit more about who should be calling and what are you saying when they call in when we get into it. So
Very good.
remember
Sure.
that. And then Kim, go ahead and tell us a little bit about your role. So you actually work at a different organization called Second Wind Fund.
Yeah, so I am the program manager for Second Wind Fund, and our goal is to work on the youth suicide prevention side of the spectrum.
So important.
We definitely want to be working on the prevention rather than the postvention, and we work with qualified referral sources, and I would say 90% of our referrals come from school counselors who call in and say, well, we have a kiddo who we think needs a little bit of mental health support, so we'll pay for up to 12 sessions of mental health with our network of providers, and those kiddos will get that free of charge, so there will no cost to the family.
That's tremendous. Thank you. And you told us a little bit about some of the things you do, which is you're a dance therapist. Is that right?
Yeah, so by background, I'm a dance therapist. So for those of you who don't know what dance therapy is, my kind of quickie version of it is if you think of art therapy, instead of using art, I use movement as my modality. Most people hear dance as the key thing. I'm like, oh, I have to get up and dance, and it's not quite like that. It's definitely more of using the body and incorporating movement into it and using movement tags, but I could go on about dance therapy. But we're here to talk about youth and teens' mental health, so let's dive into that.
Yes, but thanks for sharing that. We might get to that, don't you think?
Fair enough.
She could get us up dancing, but I don't know. So one of the things we just talked about, right, is that mental health has this really heavy, serious feel to it. And one of our goals is to really just talk about it and to make it just like a physical health issue that we have is mental health, and that they're so closely tied together. And right now today we want to talk about kids. So tell us a little bit. You may have thought about this, but tell us a little bit about many kids may be struggling, but they're not necessarily reaching out for help. From what I understand, Colorado has a pretty high rate of teen suicide.
Sure.
And tell us a little bit about the problem, first of all, and then maybe why people are not reaching out, why kids are not reaching out. So tell us about the problem, too.
Well, Colorado does rank high. The country, they're ranked number 7 with suicides, death by suicide. Now, that doesn't necessarily mean youth only, but certainly
Right.
we rank very high. And a statistic, 3.2 million, not necessarily Colorado, but these are statistics from Mental Health First Aid, 3.2 million 12 to 17-year-olds have had at least one major depressive episode within the last 12 months.
That's a lot.
And looking at it, what's also sad is that the normal person or the average person waits 10 years before getting treatment.
Wow.
So if you have a mental health presentation, which means it's disrupting your ability to go to maybe school, relationships, just not feeling well, to go 10 years like that is such a long time before you get help.
Yes.
And relating it to the medical, you wouldn't say if someone had the flu, wait
Just wait 10 years, you'll be
10
fine.
years you'll get better, or
Yeah.
cancer or something.
Yeah,
But
no, I
why
wouldn't say
within
that.
mental health we put it into those camps of, well, you'll get better soon, and
Right.
many last 10 years before they get their first treatment.
Yeah, yeah. And Kim, what are you seeing is the problem? What kind of are you noticing?
I think there's also the big thing about mental health stigma, being okay to talk about it. Like there is that piece about stigma. And also, I mean, think about cultural and social barriers too. Is it okay to talk about mental health? That can play into it as well. And then sometimes, kiddos don't always have the words to explain what's going on for them. So it's up to adults to sometimes figure out what's happening and help the kiddo understand what's going on as well, amongst others. But those are some of the other
Yeah,
ones
that's
I
a
think
great
of.
point. So what should parents be looking for when they see signs or symptoms? What should parents be looking for in their youth?
And one is a change.
Okay.
Whenever
Any
you-
change?
When you see a change in behaviors, and especially we talk about suicide, you can have a change going from more sad, maybe isolating, to all of a sudden they seem better, happy, and they have more motivation, and they're planning something, which actually can be a high symptom for suicide risk, because they may
Really?
have made a decision to die by suicide, and now that's sort of off their chest, and now they're actually planning that. So if they've been sad and kind of on the depressive side, and then quickly you see a change, you want to take notice of that change and start talking to them and maybe get an assessment.
Oh, wow. And so what would be maybe a way to get an assessment?
I mean, one of the keys is people need to talk to each other. And so
That seems pretty basic, but the reason you're saying it is because that doesn't happen.
people then often are afraid to talk about suicide because they have a fear of putting it in their heads, but it's known that talking about suicide doesn't make people more suicidal. And if someone's thinking about it, you could just ask them, well, have you ever thought about killing yourself?
Okay, so you
Is
can
that-
just ask that question.
Ask it
It's
into my...
really important to blatantly ask, are you thinking about it? And not word it as, are you thinking of hurting yourself? But actually stating it. Because self-harm is different than thinking of dying by suicide.
So what would you ask? What's the exact question you would ask?
I think it depends on the age of the child
Okay.
I'm working with. But, put a blank question, I've noticed a change in you, and I'm curious, are you thinking about killing yourself? Just a blatant question, get right to it. It's-
Wow.
As it was alluded to, it's not going to put the idea in their head.
Wow. Yeah. Okay, good. Thank you for
You
telling
can
us that.
you can ask, like, well, have you wish you weren't born? And then, well, have you ever thought like you wish you weren't around? Do you have thoughts of killing yourself? And then if it is, well, I've kind of, then you have to say, how would you do it? All of this is increasing the level of risk.
Okay.
So if they have a plan, then you need to not let them out of your sight, and then you need to be calling the crisis line, which we'll probably talk about. Or
Yeah, we're going to
911.
put it in the feed, the crisis, Colorado crisis line. So tell us about that right now, since we're talking about it. There is a lot of services and help available if you call that line. And so do you know kind of like what that looks like? Because what I understand is that you can text the number and you can get a mental health professional almost any time of the day and in the evenings. And whenever you call that line, you will get a mental health professional on the line that can actually help you. So we're going to put that crisis line in our feed. And that's not just for teens, that's for teens and adults. So we do have some questions here. I mean, do you guys want to add anything about the Colorado crisis line, or did I accurately?
It's a great
It's a
service.
great service,
Yeah.
yeah.
That they have it in Spanish as well, and so you can just call, and you don't have to be in crisis to call. That you could be like, I'm just a little concerned. Call. They help walk you through then what you need to do, and if there is high risk, then they can help mobilize help to be released.
That's a great point. You don't have to remember all the stuff we're telling you today. If you have a suspicion or you need help, you could just call.
Call the line.
Okay, good. That's a really good point.
And teens
Thank
really
you so
like the
much.
texting option too. So teens tend to use the text too as well.
Okay, so I'm going to interrupt our conversation because we have some questions, and you may or may not be able to answer them. I get that, but so Jennifer says, I used to be embarrassed by getting mental health help and seeing someone for that. But actually, it's a great thing to have a professional listener. So that's
Yes.
actually a great point. Yeah.
Well, the reality is, all of us go through life's trials, life struggles, life's difficulties. And so for someone to be like, oh, you have problems? Well, we all go through struggles. It's just those, why not get help, learn some coping skills, learn some mechanisms to be able to then manage better our trials.
Yeah, no, I agree.
And it's something we all can do is to help this stigma that is with mental health. And I often think, like, if someone robs a bank and they have schizophrenia, what you're going to hear is this schizophrenic robbed the bank. If they had another disease, diabetes, you'll never hear that diabetic robbed the bank. You just hear the bank was robbed.
Right.
So we always put this stigma on, and what we can do is help remove these stigmas.
Right. Okay. Really good point. Really good point. So I told you guys before we started this that people would tell us if they couldn't hear us,
And we're
and
not.
they're telling us that they
Okay.
can't hear us. So I know it's counterintuitive, but if we could speak up a little, that would help people, and they would be able to get this really, really important information. So I know you guys are with me on it.
We got it.
Okay, so tell us a little bit about how is adult or youth mental health different, and how is that different from adults? Like, what do you do differently for teens and young people than you would for adults, if anything?
I think there's a piece about being very developmentally conscious too. Teens are still growing up, as kids are too, and working from that perspective, as well as thinking about the cultural context as well as the family environment too, bringing the family in as appropriate in order, because we all live within an environment and a context, and we could work on something in a counseling room, but then you put someone back out in the environment and they need the support out there as well.
Okay.
Yeah, I mean, on one, we always, in whatever therapy, we try to meet people where they're at. You know?
Now, is that some of the reason why we have something like this?
So what we try to meet people where they're at is different people will express themselves in different ways. So we already heard about dance therapy. It's one way of expressing. What we have in front of us is a sand tray, and you can have directive, which means you have them do something,
Okay.
or indirective, where everything's removed and where they're expressing by how they're feeling, they're touching.
Uh-oh.
Sometimes people will want the sand to pour out of their hands, which can almost be a form of releasing.
Oh, like, so just doing this may be
It-
helpful.
To help people realize mindfulness, it's called, where am I in the moment, it's the textures, and I often use this with, even with trauma work, you know, what do you feel? To get people out into the moment and working like that. So
There's
the key,
people here.
and even adults certainly can benefit from this. So sometimes you think, well, let's just do talk. Well, adults can benefit from dance or sand or whatever is needed to express. So there's many ways of expressing than just verbally.
Okay,
And
good.
so that's where developmentally we try to meet the child or a teen where they're at. How do we help them express, relate, bring out what's there?
That's great. Yeah, so it's not just sitting in a room talking.
That's correct.
Yeah,
for
so
sure.
you can see we have some other things, toys, maybe even for younger kids, that just help them a little bit more as opposed to just sitting here talking to someone, because that can seem, I don't know, hard,
Awkward,
awkward. What do you hear? How is that for people when they think about it,
Well,
just
certainly
sitting and talking?
it is often like that. And one of the things we try to do is, you know, breathing techniques and being able to relax breathing. So I'll use bubbles, I'll use balloons, we'll make it into even a competition.
Game.
Then be like, what'd you experience with that? And and so, it's creative, which is kind of the fun of it. You have to be a little bit more creative, but you have to read your person. They'll communicate with you what they need, and so then we just help. We're not trying to be obstacles. We want to help facilitate what that individual needs.
Yeah, you guys are really special humans, I gotta say, because you're able to really hear all of that, and sometimes it's kind of heavy or problems is mostly what
No
you
doubt.
get, and so really I'm just present to, I would just acknowledge you guys for the work you do, and especially
Thank
with
you.
our young people, right? So really thank you. So here's another question. What are some influences that might cause mental health issues? Are there some common things?
So there can be many things. I mean, there can be something all the way from genetics too, because some people have
Okay.
a predisposition to. For example, depression can sometimes be passed down from generation to generation. How a child is raised, sometimes family environments can cause it. Not everybody will react the same way though. What might be a stressor for one person may not be a stressor for another. So I can maybe go through a traumatic event, but it wouldn't seem like a traumatic to me, but might be
Right.
traumatic to you.
Right.
So there's some bit of a individualized piece there too.
Well, that's a great point, because you could have somebody say, well, I went through much harder things than you. Why are you out reacting like that?
Right.
And so it's important to
It's
realize
different.
everybody's going to experience process in their own way. We got to take people from where they're at.
Right.
But the other, certainly trauma, certainly difficulties, lack of relationships.
Head injury, someone can get hit in the head.
Oh wow, I didn't think of
If
that.
you think
Yeah.
about traumatic
Sure.
brain injury and PTSD, those are commonly linked together.
Okay, so there can be a lot of different causes, and everyone's going to react just a little bit differently, just based on who they are. And
And we have developmental as well. We see, developmentally on spectrums. You hear autism talked about now, which doesn't mean you got very bright kids, but still have some developmental challenges, which can make it then harder to process, or where do they fit in this world, the relationships,
Right.
which can cause, can be contributing factors.
okay, good. So things that could cause some mental illness, and if you're looking at your community and you're seeing some of those issues, maybe that's you just keep an extra eye out for any difficulty. Does that sound right to you? Like if you know your family is predisposed to depression, for example, maybe you just watch it a little bit more. You know the signs and symptoms, and does that sound right to you?
Sure.
Okay.
And do something.
And do something. Okay.
Let's say you notice somebody in your family and you're like, hey, it seems like you're maybe struggling here. Well, I'm not. Can I help you with that?
Mm-hmm.
Why don't we go talk with somebody, at least see what they think?
Okay.
One of those, when we talk about mental health and why it's such sort of the stigmas, we all should be actively bringing down the stigma and helping people to at least get connected somewhere.
Okay.
So it's not the 10 years.
Yeah, cut that time down would be good, right? Yeah. Okay. So, what are some of the influences that can help teens struggling with mental health issues before it gets to the point where there's a real, problem, like that 10-year problem?
I think having relationships too, like really strong relationships with appropriate peers, with adults, having trusted adults, I think is a big one. There was a big national study that talked about how teens who had really positive relationships with adults, they had fewer issues moving forward, which is a huge thing. I think that's a big one to think about too. I mean, the family time, sitting down and having dinner with the family at night, some of those simple things, checking in with your teen about how they're doing at the end of the day, making an effort to show up to their activities, having a good school environment as well. Like school is a great place, and I think engaging the whole community as well. I think it's not just one person, it's not just two people, it takes a village to raise a child.
That's a good point. So bringing more adults and having your child be having relationships with adults is important.
Mm-hmm.
And for adults to realize, what are we doing in the lives of other people? Even they don't have to be necessarily your children, but many can be helped and caught with. You can have faith-based groups to connect with. Maybe there's a school teacher, oftentimes coaches, extended family, can make the difference in a life. And I think of two things which are important, which is to say, I have hope for you and I care about you. Just that simple message, I have hope for you and I care about you can go so far when somebody realizes, oh, there's somebody in my life that has hope and cares for me, even if they're not getting it necessarily at home.
Right. That's a great point. So those are some things you can do and say. It's hard to actually talk about mental health in teens without, pointing to the recent STEM school, the shooting there, and I think that when that happens, it brings up things for people that even weren't at the STEM school on that day. I spoke to a friend of mine who, had an experience years and years and years ago. She was in a store where there was a shooting. And she said that every time something like this happens, whether it's here in Colorado or somewhere else, a shooting at a school or a shooting, it brings it all back up for her. What kind of advice do you have for people like that?
We're certainly not commenting on the STEM and things that happen
Yeah,
there, but
yeah.
in a general sense, sort of what you're talking about now is trauma. And,
trauma.
And trauma can affect us. What happens with trauma, right, is we have the fight or flight in our brains, which gets our body going, and sometimes later than on life, there's a memory that can trigger sort of those feelings again. One is talking about it.
Okay.
So again, instead of maybe waiting, maybe your friend did that, and but it's maybe not just wait, but to say, what, after a couple weeks, if things are still there, go talk to somebody. Go get some help working through trauma.
And does it have to be a professional, or could it be a friend or family member? What's your advice?
It depends, of course. Sometimes talking about it, and then it's all about managing the symptoms.
Mm-hmm.
So if you're talking 2 weeks later and you're still struggling, you need some professional advice.
Okay.
If you're starting to see the symptoms of things affecting your functioning. But otherwise, we all have sort of different symptoms. I walked in my house when I was abroad, and a guy was robbing me in my house, and so
Oh my.
I'm able to sleep. I'm able to function. Of course, it's in my mind a little bit more now, safety things. But if after a while I'm still struggling, then I need to get some professional help.
Okay.
To just learn some things, express it, learn some dynamics of how to manage the trauma.
Okay. So just know when you need a little extra help.
And parents should be checking in with their kiddos too. Teens and kids, just see
For
how
sure.
they're doing it, because sometimes they may be afraid to bring up the topic, and so a parent, trusted adult can go and say, "Hey, how you doing?" Just a simple check-in,
Mm-hmm.
place to start.
You don't necessarily have to reference the incident. You could just say, "How are you doing?"
You could talk and say, "How you doing?" I mean, you can actually reference the incident too,
Okay.
and say, "Hey, I know that could bring up some stuff for you. What's going on?"
Okay. Okay. So I'm gonna ask some questions. We have people asking us questions, and so what Anne says, therapy is expensive. How can a person afford it? That's seems like a really good question. Do you guys have any kind of thoughts about that? I know Nine Health, we actually work with an organization, Spark the Change, and we're going to be rolling out an opportunity for adults. It is specifically for adults to be able to get some free therapy or counseling. So stay tuned for that, and we are going to have that on our website later on in this month, at the end of the month. And so we're going to be able to match people with a counselor or a therapist, and they're going to volunteer their time.
Very nice.
Very
Yeah.
nice.
So, but do you have any other ideas about when people say, "Hey, this is too expensive for me. I can't really afford to send my kid, or I can't really afford therapy. What do I do?"
Well, we don't have all the answers for that on this end.
Right.
But,
Right.
for example, the Mental Health Center of Denver, if someone has no insurance, then we have a program for that.
Okay. Good.
Certainly all Medicaid and things are always accepted here. The other would be that I would say there are training programs, Denver Seminary, for example, DU, where people think, well, I don't want to have a student, but often I think it can be good because a student you're not just getting the student, you're really getting the professors who are supervising that student. They're often taping, they're often watching. So those are often discounted.
Okay.
$20 a session or so. And so you can look up maybe the local institutions, even Metro,
That's a
CU,
great idea. Yeah.
and get into some of those clinics that are offered to the community at lower prices for sure.
Okay. Great.
And then some practitioners too will also offer sliding scale, or sometimes do pro bono sessions as well. So it never hurts to call and ask,
That's
"Hey,
right.
do you do a sliding scale? Here's my situation."
Mm-hmm.
I think as a professional, I'd rather somebody ask, someone give me that opportunity to say yes as well, than I would do it on a sliding scale.
Right, right. That's a great point. Okay, good. So, so I'm going to read this question. Piper says, "Talking about it won't ever help. I have tried everything to help me with my depression." So, first of all, we probably want to recommend the Colorado Crisis Line, and we will put that in the feed here. But what do you say to people who just feel like talking doesn't really do anything at all? So why even bother?
I can't comment on his
No.
question at all.
No.
And that's where sometimes people go to therapy and they're like, I didn't connect with this therapist. Well, there's nothing wrong with going to another.
Okay.
And there's no offense, or there shouldn't be an offense. If someone came to me and says, it doesn't seem like this is working, really professionally, I would agree. You know what? I don't think this is. Let me refer you to somebody else who maybe better matches your fit. So you always have the right as a person looking for help to find somebody who makes the connection.
Who
and
really
fit.
does work for you, yeah. And what about some of these other alternate therapies? I mean, if they've been saying
Sure.
talking doesn't help, what about trying some other things? Would that be something that would be good? I mean, this sand thing felt pretty good. I don't know. And then you were telling me about dancing, and that sounds like it might be useful to some people.
I think that's kind of the benefit of the way that kind of counseling has shifted lately. So
Sure.
there's more opportunities for people to explore, whether there's drama therapy, art therapy, dance movement therapy. There's so many different things that if you have a passion for poetry, there's even poetry therapy, great. Find someone who wants to work with you from that perspective.
Okay.
And then talking back to meeting where you're at. If that's your passion or if that's something you're interested in, great, start there.
There's also, pet assisted, animal assisted.
That's my favorite.
And so many, who feel out of control in life, that, to sit on a horse and to be able to manage this beast underneath them can really be empowering. So there's all sorts of modalities that are now available.
Yeah. And so taking that one step further, when you talk about teens and what if you decide your teen maybe does need help, what is that really going to look like? And so could it look like some of these things you've just described, or what is it? What should I expect?
Yeah, it can look like any of the number of things we discussed. I think part of that too, if you're going to work with your teen and getting them into some counseling, is to involve them in the process.
Oh, very good.
Especially since the age of consent is 15 and up for teens to be able to sign for their own mental health. Really get them involved in it, because they're the ones who are going to have to engage in it. And if they have some ownership in the process, I think that's huge.
That's great. Great point. And if they have part of the choosing and they're feeling comfortable with it, they may actually benefit more. Yeah. Anything else you?
No, I would agree.
Say?
I often have the caregivers call me, but a lot of times they say, "Well, my child is asking me to call. I'd like to get something set up. They're just not feeling well." And I think there is somewhat of a trend under the younger folks that are realizing I need to reach out. I think there's more talk about it.
Right?
There's more social workers in school, saying, "Look, you can talk about this stuff."
Okay. That's a good sign to me.
Yeah, it is. I mean, when I take referral calls for kiddos for Second Wind, a lot of times the school counselor or whoever makes that call is saying, "Hey, this student's asking for help," and that's a huge thing. And to be able to acknowledge that and praise that student and say, "Great, let's go for it."
And it's promising that you're hearing more.
Yes, I'm thrilled that they're saying that.
And there's more avenues among social media that I'm also glad to see some teens observing what other students are writing, and when they're seeing that suicidality is coming about, then they're raising the attention, which is what they need to do, because that's where some of these mediums are being used, and they need to say, wow, this person's expressing some thoughts, I need to call. And a lot of schools have set up these hotlines where they can call and report somebody.
Safe to tell.
Safe to tell, these kinds of things, to say you need to get help.
Okay.
Because if they're also putting it out there, then we want to respond to it.
Right. They're actually sharing that.
Right.
Do you sometimes think that's their way of asking for help sometimes?
Sure, it could be. They're putting it out there, they're expressing themselves, and it's great when people respond to it.
We won't go down the whole tunnel of, is social media good for our mental health or bad for our mental health, right? I mean, that's another subject for another day, but we certainly appreciate your sharing your perspectives and insight on teen mental health. I think it's so important right now, and we are covering a different aspect of mental health every Friday here in May. It is Mental Health Awareness Month, and so we appreciate your tuning in and joining us. You can still ask questions in the feed. We had some good questions today, and if you will keep an eye on it, and we will put the crisis service line right in here, so that if you do need that, you can reach out. And we encourage everyone to talk to their young people, talk to each other, and really make connections. And if you do need help, please do reach out. So thank you so much for joining us. This has been our Health Happens and education series on mental health, and we'll be back next Friday, so we'll see you then.